Hello, everybody. This is Friday, September the 25th. Welcome back to Anne Insights. This is the first video, and we have a lot to talk about since the last 2 weeks. So this is the Epidemiology Part 1 video. For people who don't know, one of my wonderful followers there has been putting together 2 PDF, one that keeps tracks and keep a timestamp of all the videos. So if you're interested in getting more details, you can go through that PDF and download it. It's posted on YouTube, and there's another one that's a time index by keywords. So let's look at part 1. Some good news. It looks like India is going down, but we have to see how good the data is. But in the US, we're going to talk about an upsurge, unfortunately, mostly driven by the Midwest. We are reaching several key milestones: 1 million deaths worldwide, 200,000 deaths in the US, 32 million cases in the world, 7 million in the US, and 800,000 in California, all of that in the same week. So these are unfortunately really bad milestones. In the second video, please go check on YouTube. I'm going to expand on more information on the long-term damage, especially the cardiac and the lungs and the neuro. Some new information just come out this week on the infection of young people there. I'll talk about trait immunity and some update on therapeutics and vaccine. So if you look here, India has passed, is now the #1 in the world. We have to see what's going on with that drop. The US, you can see, has an uptick. We'll talk quite a bit about that. So let's kind of get the show rolling. 32 million cases and 1 million deaths. I mean, this is not the flu. Let me reinforce that. This is a real pandemic. And you can see that the US now is past 7 million cases. India has 5.8. And at the rate India is going, India may pass the US in the next several weeks. Brazil is slowing down a little bit there. So India has passed Brazil in 4 million cases. And then we quickly drop to Russia, who is having also a bit of an uptick right now. And unfortunately, Peru has a lot of problems. Global deaths probably be by early next week, will be at 1 million deaths at the rate we're going. And of course, unfortunately, the US is leading the charge with the death rate. And also India has a very high caseload. They have a lower mortality rate than the US. We're expanding by 300,000 cases daily worldwide. I want to let that sink because that is such an enormous number. To give you an idea, if you look about, we went from 1 case to 1 million cases. The first 1 million case worldwide took 90 days. Now we're at 37 days. So pretty much on a monthly basis, we are adding around 10 million cases worldwide. And these are the reported cases. And we all know that we may underestimate the number of cases by a factor of 5 to 10x. So India has now the highest record. At some time, it hit 100,000 cases. Now it has dropped to around 86,000. We need to understand why there is that drop. It's been for the last several days. The United States, as you can see, is having an uptick. So we dropped to around 35,000, and now we're back up to 43,000. Brazil is steadily, slowly coming downwards. Russia is having a little bit of an uptick, and we'll see here there's a lot of things happening in Europe. So the daily death is still around 800 per day in the US. India has passed over 1,000 per day. And Brazil is at 700 and Mexico 500. These are the 4 leading countries in mortality on a daily basis there. India is a hotspot. They have 5.6 million cases and 90,000 deaths. They peak at 100,000 daily cases, but then drop. And the question is that, is this due to under-testing, or is there really a drop in the infection rate? Some areas have shown a serology testing, which means the amount of antibody that people have at over 50%. If it is over 15%, that means we're seriously under-testing. So the drop there may not be the reality of what's going on in the country there. It is perceived that the serology may be as high as 95% in the whole country of India there. That means 25% of the Indian population has been exposed. Some good news, I tried to find some. Brazil is reporting less confirmed case, but Manaus, for example, which is in the middle of the country there, in the Amazon, has a prevalence between 30 to 52%, depending on the cases. This is the highest number I've ever seen worldwide of the prevalence of Manaus. If anybody has been there, I did go there some years ago. There's a very high density in the middle of the Amazon there, so there's a lot of issues about access to care and poor population there. Mexico is also slowing down, so that's really good for our friends. The question is, are they under reporting because of the testing? Europe is having a serious second wave, and we need to really learn about this because we don't want to go through this. The US is still going through its first wave. And if you look at this number, it is pretty terrifying because you can see that Spain is at a higher daily rate than they were in the spring. France is also seriously going up. Now, we're going to see it's a younger population, but it's still, that is a serious a spread of the virus there. UK is following straight behind it, and we see some of these other countries there, like Belgium, for example, took off and they took some drastic action. You can see that had some effect pretty quickly there. So let's take a look. Madrid, for example, has shown that that 25% of the patients in the hospitals right now have COVID, and the positive rate that they're having in Madrid is 23%. That means there's a serious infection all throughout the city there. That has led now to partial closure and some new regulations. A lot of the drivers about this is the summer. People went to the beaches. Honestly, people are getting tired of all this thing about COVID, and especially the young population there. They are now putting new restrictions all across Europe. Every country is slightly different, even within the countries. And it's usually affecting bar and social gatherings. Like in Belgium, you cannot meet more than 6 people at the same time. But you can see that the stringency index is all over the places. France, which is having that big spike, is cranking it up, but not the same way than the UK, who's having a big spike there. So we need to keep an eye on that in the following weeks. To give you an idea, in Europe, they've decided no longer they can afford a lockdown. We have to find a way to live with the virus. It's a major change in the way they're tackling the problem. That means we need to coexist with this virus long enough that we can control the virus through better therapeutics or better vaccine. That means this is a 1 to 2 year process on how to live with the virus. Wearing masks, social distancing, being able to bring the incidence rate to below 5% so you can do tracing effectively right now, which is kind of the magic numbers. And also be able to react nimbly and locally so that you don't just get one rule for the whole country, but you do it for the area that's affected there. And people are now creating what's called these support bubbles, where you create a group of people there that are safe, because they all have the same philosophy you have, and you limit the gathering size to these bubbles. And to give you an idea, France is now having 54,000 new cases per week. And they have a positive rate that went up from 1.5% in July, the beginning of the vacation, to 5.4%. So we clearly have what we call the second wave. Most of the cases are being driven by the young population all across Europe. That's why you have a low mortality rate. But what the problem is now, we see 3 to 5 weeks later an increase in the elderly. And of course, the elderly is what drives mortality. Belgium is having the same problem there. You can see the infection rate, like in green, and they had this huge death problem there. And you can see they're back to the level they were in the spring, but they've been able to control the mortality rate. Now we have to see in the next 2 months if it goes from the young to the elderly. That's the big worry. Spain is another hotspot, and whoops, going the wrong direction. And this is some, you can see that it has now passed the level it was in the spring, and it's significantly higher. In Madrid, for example, 25% of the hospitals, have COVID, and they now have decided to get some partial closure of that. Here's the bad news: the mortality rate, with that delay of 3 to 5 weeks I was mentioning, is climbing up, and we may see the same thing in France and the UK. Israel is having a similar problem. This is what happened in Israel when they shut down the whole country pretty much, and look at the difference. I can even see it's a 3x multiple to where they are. So this is a significant second wave. And if you remember, that's what happened in 1918. That's the big concern everybody has, is that the second wave in 1918 is the one that basically had such a high mortality rate. Here's the UK, again, vertical rise again at the same level they had in the spring. So why is the problem? People are not wearing a mask. I don't know how to say that and how many times I have to say that. But look at Korea. Korea has totally control. They had a little bit of an uptick there. They immediately smashed it and control it. And you see, Italy, when they were in deep trouble there in March, when they had a high mortality rate, people wearing masks, and then it dropped. The United Kingdom really never accept wearing a mask. That was the culture there. Now, because of the uptick, people have started finally doing it. And the United States has had this very politicized percent of Americans are wearing a mask, and that's why we're having still a fight with that first wave. We're not even dealing with the second wave yet. And this is tying to the diagnostic. So interestingly enough, because people in Korea are wearing masks, the test per 100,000 is pretty low. What they do is that they have these SWAT teams, so that as soon as an infection them, they have a group of people, 10 people who arrive there, do massive testing, do contact tracing, and immediately isolate the people and stop the spread. We are not able to do that because our infection rate is above 8 to 10%. And so what you see is that we are not trying to compensate with diagnostic tests, but by the time we do the diagnostic, we get the results. Those people, if you remember, we discussed this in prior videos, are contagious when they're pre-symptomatic, which is 100% of people for 3 to 4 days are pre-symptomatic, and they're contagious. That's a peak infection rate. And up to half of the people after they start become symptomatic are still contagious, but they're mild enough, they're not really doing anything about it, they're asymptomatic. So that's the problem we're having. Instead of wearing masks, which is effective, we're trying to control the virus with tests, and it's not working. So Sweden, there has been in the news this whole idea we should follow the Sweden approach. I'll bring it up. So Sweden claims a seroprevalence of 20%. Now remember, the goal is to get over 70% to have herd immunity. So they did not reach that 70%. But let's compare them to countries nearby. So Sweden is the dotted line. Then we have Finland, which is the dark blue. Norway is the light blue, which are the country the closest to them. And you can see that they had a significantly high infection rate. They did not try to control the disease. They let it spread through the country there. And then the US kind of did a hybrid just because every state was doing different things in there. But the impact was not only did they have a high mortality rate that their nearby country, and if you go back to some of the prior videos, they had a 5 to 10x higher mortality rate, but they show that the GDP of Sweden here was as bad as the other country that did a shutdown. So they didn't really save the economy by keeping it open. And they expect to have a lower recovery because they still have that high infection rate that's kind of putting constraints on reopening the businesses there. The countries who have done the best are the Asian countries like Japan, Singapore, and South Korea have been extremely effective at controlling the disease. What that means is if you look at the GDP growth during the second quarter where we did the partial shutdown versus fatality, you kind of wonder if there's a relationship. And you can see that Belgium and the US, who had the very high mortality rate as well as Chile, there's unfortunately a correlation with having a drop of the GDP between minus 10 to minus 15% for that quarter there. But then you look at Japan, and Japan, they basically were able to control a mortality rate with a similar drop of GDP. So the whole idea that, the two were correlated, I think is not showing up. And so the other issue that is going to come and hit everybody is the fact that there's a domino effect to the COVID, which is people have been delaying their vaccination and the diagnostic test. And we talked about like 2 weeks ago about the impact on breast cancer and pancreas cancer that could create an extra 10,000 deaths just because people delaying and they end up being sicker. So, and then we talk about mental health being 40 to 50% of US right now is under severe mental stress. On the US side, you can see there's an uptick. So we're going to do a deep dive on that. And as a result of that, you can start to see the mortality rate was clearly going down. It's not flattening up, and I would expect will start going back up. So over 202,000 deaths. That's more than the last 5 wars combined. If you combine the Vietnam War, the Korean War, the Iraqi War, the Afghanistan and Persian Gulf, it's more than the number of that. The numbers, we're getting numb by the numbers, but these are real people there. Remember, World War II was 400,000. The way we're going, we may pass that by the spring of next year there. And so it's an average of 858 deaths per day since the crisis started. These are astonishing numbers. If you look at the cause of death, now COVID is the number 2 cause of death in the US, just behind heart attack, ischemic heart diseases. It's now more than, other type of like lung cancers, which used to be the second leading cause of death. And I suspect it will continue to climb up. So this is based on the projection for 2019. So this is a little bit scary. This is the Institute of Health and Economics Day, which is what the government released, used to do forecasting. And so far, their forecast has been right on target. And what they are projecting is 3 scenarios. One scenario, if everybody used the mask, which is the light green, and then they expect if you have that death rate will go up from 200K today to maybe close to 280,000. What they believe is the reference area, which is what we're doing today, is we may end up at 350,000. And if we basically continue to ease, which in some states we're doing, we can climb over 400,000. So we pretty much expect a major tidal wave hitting us. And they came to the recommendation, again, this is a government organization there that's being trusted, is that if we could have 95% of the population that increase their mask use when they go outside, we could save 115,000 lives. And I think we really need to pass that message across. And we could decrease the extra deaths by 62%. This is what's expected by January 1st. This is the percent of the people in every state that will be infected. And you can see that whole Southeast, which is having issues wearing masks, is expected to have a very high prevalence of infection rate, where you see the Northeast and the South and the Northwest here has a much lower prevalence. There's an amazing difference between 1 to 3 in this area there in the dark green, up to over 20% in the orange colors there. These are their projections. So the majority of the fatality that is expected in the next 4 to 6 months is going to be from the south part. So let's look at the real numbers. And right now, unfortunately, California has passed the magic number of 800,000. Texas is on its way to pass us at 747. They're climbing very fast. We'll talk more about that. So is Florida at close to 700,000. And then remember, New York, which was the big crisis we had in the spring, is pretty much half of what California is. So that kind of gives us some perspective how much we lost control of this pandemic. The new dashboard, we do 300,000 cases per week. And so we're roughly at 7 million right now. And you can see the death rate. And this is the worrisome. Texas is doing 45,000 cases per week. California is 24. So Texas is double the rate of California, which means they will pass California over time. Florida is still climbing pretty quickly there. We're going to talk about a lot of those states there have very high growth in their number of cases. So if you look at the number of daily cases, we went down as low as 34,000 and now we're back up to 44,000. And if you remember 2 weeks ago, this graphic was a whole bunch of very light colors. I call the pastel color. And guess what? The orange and the dark are coming back up. So we have that whole Midwest is lightening up. And there was an interesting discussion with Scott Gottlieb, who used to be the FDA commissioner. And his view was that we are underestimating the number of infection by a factor of 10 to 20x. This is his quote. And so he's estimating that, a real infection rate is probably even higher than what we're reporting there. It could be 800,000 per week. So why is that an issue? He believes that we're only diagnosing 10% of the infections. So when we talk about case, we're talking about confirmed case. He expects a significant second and third wave in the winter there. Now, the good news, and I'll talk more about this, is that we're doing a better job at treating people in the hospital. So mortality rate has gone down. But there's still, people who get really, really sick with long-term problems there, which we'll discuss in a second video. 15 states have positivity above 10%. That is really bad news. That means it is a pandemic in those states, and that means it's hard to control. 13 states have R-naught above 1. R-naught is the number of people you infect. So if your R is above 1, is that for every person you infect another person there. And most of that are the Midwest and some of the southern states. It is expected that the flu, which was a big concern, it will aggravate the hospital's healthcare delivery system over the winter, may be not as aggressive this year. But when I talk to my friends in Australia and South America, what's happening, everybody's wearing masks, taking social distancing. So the flu may be the same as normal. It's just, people are not getting as infected, which is hopefully good news and maybe a lessons to learn. His view was people need to anchor down. This is not going away for quite a while. And you should basically decrease your cumulative exposure risk. I mean, we have to go out and shopping and do all of that, except instead of going shopping twice a day, you need to shop maybe once a week. He believes that the seroprevalence in the US is around 8%. Miami could be as high as 20%. And New York could be in the same zone. So when you get to the 20% there's a slower spread of the virus, because if people wear masks, you're stopping the amount of viral load that's being transmitted there. And he personally don't believe in the cross-reactive T cells we have talked about, because he says, yes, you may have a lower reaction, but you still get infected. So let's look at the hotspot. This is a graphic that just came out, and it's fascinating because it shows that this virus is just moving from one state to another. So if you look where the hotspot were 90 days ago, it's kind of the light pink color there, and it's slowly moving. If you remember, the Northeast is when it happened in the spring, and then it moved to the Miami, that whole area there, and then start moving to Texas, and then went to the West, and now it's moving in the Midwest. The whole country is going to get hit by it. It's just a question of people traveling and spreading it with them. And this is the numbers that makes you pause. In a period of 3 weeks, if you look at the 7-day average, Arizona has gone up by 75%. Colorado has gone up by 100%. Montana by 67%. And so you start to see Utah by 134%. So these are significant increase. And what it shows is that the virus that was really a hot spot in this area there is now spreading into the Midwest and following people traveling around. So we're still having a pandemic that's just moving around the US. Let's look at the numbers. New England, you can see, is still continue to manage pretty much under control. Mid-Atlantic, which was the New York, New Jersey area there, they're controlling it. They still have some infection there, but keeping it under control. Midwest, unfortunately, this is the hotspot that we're having. South had that huge spike with Florida and Texas. It's still very high rated, and they're still not under control. And then the Southwest and what I'm missing here, the Northeast there, are basically under control. So Wisconsin, to give you an idea, the daily incidence has more than doubled in the last 2 weeks. So they've just issued a statewide mask mandate. Nebraska and South Dakota have increased by over 40%. And so we absolutely cannot have these rallies and all this super spreading event because they're under attack by the virus. So this is another visual representation. You can see it's all from Texas going straight up north into the Midwest. The numbers are terrifying. You can see Wyoming went up by 137%. Utah, this is a different source, but these are massive, massive increase. We don't want to see those numbers. That's mean it is not under control. And so right now, California is doing an okay job. We'll talk more about that, and the Northeast. But really, this is an area there that's spreading. So as a result, if you look at what is expected to be the percent of infection rate, we clearly had the whole New York corridor in New Jersey that got hit in the spring. We clearly had the problem there. I think this is Arizona, if I get my geography right. And you can see that this area there that was kind of, not being hit by the virus, this is where it's spreading. It's an open territory there. So, and that reason is that we have 8% positivity rate, but look at those states that are still above 10%. 10% means we have no control. Florida, Alabama, Nebraska, Arizona, Idaho, Virginia, Texas, these are all high population area there. Still having an outbreak. This is a graphic that just came out, and it was interesting. It shows that there's a lot of news about colleges and what's going to happen at Thanksgiving when they go back to their families. Are we going to spread the virus more? And what they seems to be claiming here is that of the nearly 3,000 colleges in Texas and some of the Southeast area there has been some outbreak, but most of the other area there seems to have done a good job. For part of that, as you know, is the West and the East Coast. I still have college online classes there. So it could be in-person versus online classes there. The good news is that we have decreased mortality rate, and that's because we are doing a better job at managing people in the hospital setting there. So you can see that the mortality rate has dropped. It went as high as around 6 to 10%. I just was talking to some people in New York. They said the average was 10%, but now it has dropped probably to 3% on the average. That's all age category there. And so we do a good job at avoiding people to be hospitalized if we can, and avoiding them getting to the ICU if we can. And that's the age group. As you can see, the mortality rate is the highest over the age of 60. It was a big peak here at over the 80 there. But keep in mind that the young people can die. So this is not just a disease for the old people. This is a fascinating story there. It shows the mortality depending on the city you live in. So New York, was the first one that took the hit, so they had to learn on the fly. And you can see the mortality rate per 100,000 cases is a huge number. It's 28 times higher than what San Francisco is. So depending where you are, if the healthcare system is not overwhelmed, you have a significantly difference in outcome. Los Angeles, which is still part of the state of California there, so they had the same learning lessons that we got. We had 3 to 4 months before we got hit, but they're getting overwhelmed in some of these areas there, and you see a 5 times higher mortality rate than San Francisco there. Oops. So let's talk about California. We have 800,000 cases by the end of this week. I think just got announced today, and 15,000 deaths. And you can see with a bit of an upswing there, we need to keep an eye on that. Most of the Central Valley is where we have the purple color there. This is when we have the very widespread spread of the disease. The good news, a positive rate is 3.6%. Which is great news. That means we have the virus under some control. It's mostly the Hispanic population that has a higher number of cases and a higher mortality based on the mix. The mix is the little bar of the population there. The white population, has a low mortality, but that's mostly due to exposure. A lot of the Hispanic population is the lower income jobs, and they have to go outside, and therefore they have a high chance of getting exposed. So the mortality rate in California has dropped from 5.8% to 2.1%, and that's really thanks to the incredible job that the healthcare workers are doing. That they're really doing a good job at managing the staff more effectively, managing the supplies, knowing where to treat people for the hospital workflow there, and try to minimize the ICU, the ventilators. And you can see that the mortality rate has dropped for all the different age category there. I mean, clearly, a mortality rate for the elderly there, is still around 10% over the age of 65. So this is something you still need to be very careful if you're over the age of 65 years old, not to be infected. That's a 10% mortality rate. That's not a good hit. And the K-12 school tracking there, I will post this on YouTube. This is an interesting article from the New York Times. And not every state is tracking the infection in the K-12 schools. You can see all the different states where there's some data available and some states that don't share it. But for the one that do share it, when you click on that website and you click on that state and that city there, you can really see the drop down by school district. And I think right now the big news in the school is that there's lawsuits on both sides. Some people are trying to keep the classes online, and some of the people were trying to force the class to be in person there. And so that's a bit of a messy situation there. So thank you very much for listening to this week. Please listen to the clinical video. There's a lot of great news that have emerged, some good, some bad. So I'll see you in 2 weeks, and please listen to the clinical video.